you have seen a lot of shifts, and one that you've nailed in a very interesting way, and I'm quoting, it's been from sin to syndrome.
Yes.
From a Christian society, you're saying, to a therapeutic society. What would you say is a therapeutic society? How's it manifesting itself? Why is it problematic, to use a term that's bandied around a lot?
Yes, I mean, I think that's right. And I can't even, I'm not even sure that phrase is mine, sin to syndrome. I might have picked it up somewhere, but it captures that shift very, very nicely from a sense of moral culpability, which presupposes moral agency. And I think culpability and blame and sin, they're not nice words these days, but in fact they're words that do belong to a sort of conceptual web of nice things, of things that have always been recognized to be important. To recognize somebody as having committed wrongdoing rather than simply being the victim of some pathology is to treat that person as free and rational. And Kant, I don't agree with Kant about much, but Kant is right that at least part of what human dignity consists in is freedom and reason. So to treat somebody as a sinner is to treat them as somebody who is free and who is mature and rational. To treat them as a patient in the grip of a syndrome, I think, is not to treat them with their full humanity and dignity. Worse, it is, to coin another fashionable word, disempowering, to say that somebody is in the grip of a pathology, a syndrome, rather than a sin. Why? Well, if you've committed a sin, you can seek forgiveness. Certainly within the Christian traditions and other religious traditions, there are mechanisms, salvific mechanisms, the mechanisms for absolution and repentance and social recognition of second chances as well as condemnation. If you've got a disease, if your wrongdoing is a symptom of something that is wrong with you or wrong with your mind, you're stuck with it, really, or at least it's much less obvious how you get rid of it. Do you medicate your way out of it? Well, yes, sometimes. Do you find a therapeutic way out of it? Well, yes, sadly, sometimes. But most of the time, these are problems that are fixed. I have this condition, and there's no way I can sort of get out of it. And so, crimes start to be treated as diseases, and criminals or wrongdoers start to be treated as patients. And the state then turns into not that which gives expression to social condemnation through punishment and retribution, but rather the state becomes a kind of omnicompetent therapist. And that's a very dangerous development in my view, because we know that our moral instincts, shared moral instincts, help us to track moral truth, broadly speaking. There's a moral consensus in every society. Classifying pathologies, classifying diseases, particularly psychological diseases, are, as it were, that is a very tricky business. You need to get in the experts. Who's in control of the experts? The state is in control of the experts. And so you actually move from a position of sort of moral consensus, and I think democracy depends upon, the plumber that's leaving school at 16 having just as much just as capable and fully functioning moral capacity for moral judgment as a fancy professor with multiple ethics degrees. So we shift there to morality. Moral judgment becomes a sort of question of technique and expertise, and that I think is a disturbing development. And you see this with sort of the language of health and safety. You see it as sort of invoking and justifying very clear erosions of civil liberties. And I think one of the big, we've talked, and I know you've talked with your guests on previous podcasts, John, about this, left and right not quite being the correct prism to understand the public square through anymore. And I think that's absolutely right. And the question, I think, is what are the other spectrums and axes? And I think at least one of them is risk and safety, or freedom and safety. That's a trade-off. Clearly, we can't just allow total freedom in a way that undermines, in serious ways, public safety. On the other hand, it's obvious that we can't just live in lockdown the whole time, that there are more important things in life than the avoidance of death. We're going to have to walk across the street even though there is a minimal risk that we might get run over and so on. So how do we find that trade-off? And I think that's going to be that axis, as it were, of public disagreement is emerging more and more in recent years, partly driven by plagues, but also driven, I think, by the transposition the move from sin to syndrome, and the language of the psychologizing of medicine.